Welcome! In aged care, wound care and pressure injury prevention are critical skills for every RN. Residents are often at high risk due to immobility, chronic illness, or age-related skin changes. Today, we'll cover the types of wounds you may see, how to manage them safely, perform dressing changes, and properly document and escalate concerns. In aged care, common wounds include pressure injuries, caused by prolonged pressure on bony areas such as heels, sacrum, or elbows. Skin tears, fragile skin, often tears during transfers, dressing, or daily care. Leg ulcers, often venous or arterial, requiring careful assessment. Surgical or post-procedural wounds. Occasionally, residents may have wounds from past surgeries. Diabetic ulcers, usually on feet, requiring monitoring for infection and delayed healing. As an RN, recognizing the type of wound helps you choose the correct dressing, prevention strategies, and escalation if needed. When assessing a wound, consider location and size, measure length, width, and depth, appearance, note color of tissue, red, yellow, black, presence of slough or necrosis, exudate, type and amount, serous, purulent, odor or infection signs, redness, swelling, warmth, pain, or discharge. Surrounding skin, look for maceration or breakdown. Document all observations in the resident's progress notes and wound chart.